Good afternoon, everyone. Welcome to today's update on COVID-19. With us, as always, is Dr. Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I want to take a moment to recognize the remarkable work of the ASL interpreters who have assisted with every update for the last 4 months. Randy, Helen, and Carla have all worked incredibly hard during difficult circumstances. Thank you for helping make these updates accessible for all Albertans. Also, before my update, I want to mention that I know many Albertans are thinking about hockey right now and wondering how the NHL's hub event might be held in Edmonton without jeopardizing public safety. I do not have any news on whether Edmonton has been officially chosen by the NHL, but if it is, I want to assure everyone that safety remains our top priority. This spring, we developed guidelines for professional sporting tournaments to support safety for players, NHL staff, and media, and to minimize any risk of virus spreading to the general public. While there are many components, the approach relies on extensive, privately purchased testing, and the NHL players and anyone else involved in the tournament forming a cohort that is separate from the public. Cohorting among the participants will reduce the risks of disease spread if a case is identified. If Edmonton is chosen for the NHL's event, health officials will work with all applicable partners to ensure the guidance is followed to protect the public and those involved in the tournament. We will also ensure that public testing is in no way impacted if the NHL does pick Edmonton. The free testing being offered to all Albertans will always remain our top priority. Yesterday, because of Canada Day, we did not report an update on COVID cases, so today I have 2 days to report. As of today, there are now more than 7,500 Albertans who have recovered from COVID-19. On June 30th, we identified 30 new cases from over 6,900 tests. Yesterday, from approximately 7,600 tests, there were 64 new cases identified. Currently, there are 44 people hospitalized, with 8 of those in intensive care. Sadly, I must report 1 new death over the past 2 days. My heart goes out to all who are mourning the loss of a loved one. Whether through personal loss or other circumstances, I am deeply aware that this can be a difficult time for many in our communities. It can be especially difficult for Albertans living with disabilities. People who have neurologic conditions and severe physical disabilities depend on caregivers for a broad range of living functions. My colleagues at Alberta Health Services have developed a number of resources to support those living with severe disabilities and their care providers during this pandemic. This includes a toll-free rehabilitation advice phone line, which provides information on activities and exercises to support physical functioning and strategies to manage daily activities. It also provides links to in-person or virtual rehabilitation services and to community resources that can provide supports. Anyone who may need these services can find more information on how to access them on the Alberta Health Services website. We are also working on outreach to hear more from representatives of those living with disabilities. To better understand how the COVID response in Alberta can take into account the needs of this group of Albertans. As we continue to work on refining our response to COVID-19 to meet the needs of different groups, it is important to reflect on how far we have come and the many ways we have supported each other during these last few months. It is hard to believe it's now July. We are halfway through the year, and so far it's been a year I imagine not many of us would be eager to repeat. Yet unfortunately, although we may be done with COVID, it is not yet done with us. We must not think that the risk is over and begin relaxing too soon, or think that the virus is only a threat to other people. COVID-19 is still here. It will be with us all summer and into the fall, and it will almost certainly be here when we ring in the new year. In Alberta, we continue to identify cases in all age groups and have seen a particular increase in those aged 20 to 39. In the last month alone, we have seen family barbecues, funerals, birthday parties, and other get-togethers lead to dozens of new cases. The good news is that we are not powerless. It is on us to decide what the rest of 2020 will look like. Whatever outcome we want to see this year, whether it's in-school classes resuming in the fall, keeping our favorite restaurants open, or keeping older friends and family members safe, we have the power to help make that a reality. We must learn to live with this virus by building good practices into our everyday lives. Our best tools of defense are still the basics we have been talking about for months. If we feel sick, we need to stay home and get tested. Employers, event organizers, and others in a position of responsibility over others need to make it as easy as possible to stay home Employers, event organizers, and others in a position of responsibility over others need to make staying home when sick as easy as possible. We also need to continue to practice habits of maintaining physical distance when we go out, wearing a face mask in crowded spaces, and washing our hands frequently. For those who test positive for COVID-19, the best way to protect others is by working with public health contact tracers to ensure that anyone exposed to COVID is aware and knows how to prevent further spread. Regularly following these simple, everyday measures is our best bet to minimizing the spread of the virus in the weeks and months ahead. As COVID-19 will be with us for a while to come, it also means we cannot wait until the pandemic is over to take a break or recharge. Self-care is important, and summer is a wonderful but brief time in Alberta. We all need to take care of our physical and mental health for the weeks and months to come. With that in mind, I will be taking next week off to recharge and spend time with my family, who I sometimes fear will soon no longer remember my name. While I have the privilege of updating Albertans, I am only one small part of a remarkable healthcare team keeping Albertans safe. Next week will be a break from my media availability, but public health professionals throughout the province will continue to work tirelessly to identify new cases and prevent the spread. We will continue to post updated numbers online every weekday, and if there is any information that changes the risk to the public, my Deputy Chief Medical Officer of Health, Dr. Marcia Johnson, will be covering for me in ensuring that Albertans get the information they need. As I step away for a week, I want to remind all of us that the future is in our hands. If we continue to act responsibly and do our best to follow the guidance every day, no matter where we are or what we are doing, we will be able to strike the balance we need between protection from COVID and achieving the social and economic aspects of our health. There is no quick or easy path through this pandemic, but what remains constant is this: we are all in this together. Thank you. I'd now be happy to answer any questions you may have.
All right, we'll go to the phone line. Operator, could you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. We've heard from a few people that it's taking a long time for them to get their COVID-19 test results back, and that they've been told it may be 7 to 9 days before they can hear back. Now, AHS has said that there's been an increase in demand for testing, and 90% of test results come back within 5 days, though obviously positive results are called back within 24 hours. In your opinion, though, how quickly should Albertans be able to get a test result back? What do you have to say to those who are waiting more than a week for a result? And then should assessment centers be expanded to meet this increased demand?
Thank you for the question. As you say, I understand that there has been a recent surge in volume, which has increased, again, the demand, and in some cases, unfortunately, has resulted in that lag time between having the test taken and having a result phoned back. It's my understanding that Alberta Health Services is working to increase capacity to make these phone calls and to make the phone calls within 5 days of when the swab was taken. With respect to the assessment centres, the people who are working in assessment centres are really focused on taking the swab. And I also do want to note we've had reports of some of the drop-in centres having quite long wait times, while other testing centres that are by appointment have open slots. So I'd really encourage people who are wanting to get a test done that if you look online, you can see where there might be a test spot available near you that you can book yourself in for, because the drop-in centre does not give results more quickly than a pre-booked appointment does. So that may be a way to ease some of the wait time, especially at those drop-in centres. Again, with respect to getting the results called back, that is a different group of healthcare professionals who are making those calls. Some of those calls are being done by an auto dialer, so an automated way of receiving that. So anyone who is interested in receiving results as quickly as possible can choose the auto dialer response option when they go to get the swab done. And with respect to, again, shortening that wait time, Alberta Health Services is working on that.
Operator, can you put through the next question, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Just a couple things for you here. First, can I get a case number update on the outbreaks at Siksika and the Verve condominiums? And then also, you just said you didn't have any news about Edmonton as a hub city for the NHL. So I did want to know when was the last conversation you had with either the NHL or the Premier's office? And are you being left out of the key planning of an NHL return to Edmonton?
So with respect to Siksika, I have 10 active cases recorded, but any other detail about that would be the First Nations. So I'm not involved in that local management. The nation is looking after the management of cases and contacts with the support of the First Nations Inuit Health Branch. With respect to the Calgary condominium outbreak, we have at this point in time identified 52 cases associated with that outbreak. Again, that's based on significant amounts of testing and work being done with local public health in collaboration with the residents and management of that building. And I would again remind people that whether it's the Siksika First Nation, this particular apartment building, or any other group of cases, we should be supporting and encouraging those who have been tested and who have tested positive to continue, that others would continue to be tested by not overly stigmatizing these particular locations. And again, all the work that needs to be done to contain the spread is being done, particularly in that high-rise apartment. I'm aware of that. With respect to the NHL, I was part of a conversation, I believe it was last week, discussing different aspects of potential return to play protocols. So it's not, I don't feel like I've been left out of the loop. I believe I've had an opportunity to provide input. And several months ago, we did put together return to play safe guidelines from a proactive perspective here in Alberta with respect to the kinds of things that would be needed in order to protect players, protect the other people around the team, and protect the public. And I've been able to share that protocol, and it's been well received. So again, I feel like the conversations have been very productive so far.
Operator, can you put through the next question, please?
Next is Dan Grummett with CTV News. Go ahead, Dan.
Hi, Dr. Hinshaw. Thanks for taking my question. It's sticking on the NHL hub city bubble topic. I'm just wondering, if players would have to remain in a bubble as part of sort of that second part of the two-part quarantine that you've talked about in the past. I'm just wondering about the non-NHL staff that would support the NHL teams and their staffs and their ability to access these bubbles. I mean, I guess I'm referring to hotel staff, cooks, servers, cleaners, security guards, the other people that would help keep this bubble clean and functioning. Would they also be staying in the bubble, or would they have access in and out with testing and symptom checks?
The protocol that we've put together focuses on the critical bubble being those who have face-to-face contact with each other. That is the dominant mode of spread of COVID-19, is through that face-to-face contact. With respect to others who may be, for example, cleaning that space, we do know, of course, that transmission from surfaces is a possibility. But the difference in risk means that those particular individuals, again, there will be certain protocols for them to follow. But if there's no face-to-face contact, there wouldn't be a requirement that those individuals remain in the bubble. Again, some of those specific details about the requirements and the testing for those individuals are still being worked out. But the ones who need to remain in the bubble are those with that close face-to-face contact with the players who are going to be, again, in tournament play.
Operator, can you put through the next question, please?
Next is Anna Junker with the Edmonton Journal. Go ahead, Anna.
Hi, Dr. Hinshaw. Dr. Bonnie Henry in British Columbia recently implied that the reason Vancouver isn't a hub city is because their province would have had to have made public health compromises in order to accommodate the NHL. So how did you then decide that having NHL teams playing in Edmonton would be safe and not compromise public health here? And with cases currently on the rise, is there a chance that you could pull the plug on Edmonton being a hub city?
I can't speak in detail or really at all to how BC came up with their decision. I haven't had that specific conversation with my colleagues in BC. What I know is that in our assessment of what criteria we would require for a safe tournament with respect to if Edmonton were to be considered as a hub city, we independently came up with a list of protocols that we felt would adequately protect the public's health a few months ago, and we put that forward as our proposal of the conditions that we would need to have met in order to have Edmonton considered as a hub city. And the conditions, again, that we put forward were accepted, and I believe that with these bubble protocols, with the regular testing that's a part of the protocol that's, again, been accepted, and regular symptom checks, masking whenever people are not playing, if they are within 2 meters, those are the kinds of things that make me believe that it is possible to have Edmonton as an NHL hub city without risk to the public in Edmonton. With respect to the number of cases that we've had, again, I would say that we have seen cases in the last week to 2 weeks. Again, we've run sort of between 30 to 70 new cases a day over the last week. And what we know is that the majority of those have a known source. So we know where their exposure was, we're able to control further spread, and we aren't seeing the majority of those cases from an unknown community source at this time. I don't see, again, at the moment, if we have the current rate of cases continuing, that there would be a significant concern with having the NHL here as a hub city. And of course, we continue to monitor cases and would be very happy to work with the NHL if there should be questions about our cases. But at the moment, I believe that our measures are adequate and are sufficient to protect the public.
Operator, can you put through the next one, please?
Next is Brenna Rose with CTV News. Go ahead, Brenna.
Hi, Dr. Hinshaw. My question is about the one-site rule for workers at long-term care homes. And I know that you were asked about this recently, but we've heard from staff who are really struggling to make ends meet. And I was wondering what has to happen for this rule to be lifted, or do you think that it should remain in place for the foreseeable future?
I know that that rule has had impacts on workers who used to be able to work at multiple facilities in order to, in many cases, work perhaps more than a 1.0 FTE by the hours that they were putting in at those facilities. And I regret that, again, it's had that impact on individuals who are working hard and now they're only able to work at one particular facility. What is important as we consider our response to continuing care, knowing that it is a site where if there is introduction of COVID, it can spread rapidly and cause significant mortality in that group of people, that single worker rule is part of a best practice that's been adopted in other provinces and other countries as a way of limiting spread from facility to facility if there should be an outbreak. We did see before we implemented that rule that spread of COVID from one facility to another did happen not infrequently from people, again, with the best of intentions who may not have known that they were infectious, but moving from facility to facility. So we are not at this time looking at lifting that rule. And while we look at the impacts on every one of our COVID restrictions, we're really trying hard to balance the needs of all different people in our population to make sure that we're not leaving anyone behind. But unfortunately, there are some impacts that are very challenging to mitigate, and this is perhaps one of them.
Operator, can you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Oh, hi there. Follow up on the Siksika Nation issue. I know that you said that this is being handled by their health authorities there, but what can you tell us how your office might be involved, what your office is doing to help in the response, and if there's any concern about a spike in cases there having an impact sort of spreading outside of that community?
With any cases that happen in any community, whether that's a First Nations community, whether that's a municipality or any other community that's having multiple cases at the same time, we are always available to support at the provincial level if those local public health authorities feel that help is needed. When there are cases in First Nations communities, there is a group of people, the First Nations and Inuit Health Branch, have public health professionals whose responsibility it is to support communities taking those public health measures. And I have been in contact with my colleague in First Nations Inuit Health Branch to make sure that he knows if there is any support needed, that we'd be happy to provide it. At this point, there have been no requests from this particular community. And again, I'm confident that between the local community health professionals in partnership with First Nations Inuit Health Branch, that they are managing these cases and contacts. And I don't believe there's concern with respect to risk to those outside that community at this time.
Operator, could you put through the next caller, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Just a quick kind of recap for people in terms of what procedures need to be followed in high-rise condo buildings, and also what needs to be done when it comes to driver tests. Extra precautions people should expect when they show up for their testing.
In either of those two settings, it's important to fall back again on our basic protocols and reminders. So when somebody is going to be in a space, particularly an indoor space, with others outside of their household, they need to try to maintain a distance of 2 meters apart. In the case of a high-rise condo building, there are common shared surfaces such as elevator buttons and other door handles, things that many people might be touching. We recommend that people sanitize their hands immediately after touching those, that anyone responsible for that particular building do regular cleaning of those high-touch surfaces. If distancing can't be maintained, so for example, if there are people in an elevator, it may be prudent to limit the number of people to avoid crowding in that closed space. If there are multiple people within 2 meters of each other in that elevator, or for example, in the driver training exercise example that you used, if they're going to be within 2 meters of each other in the car, recommendation is that everyone who's going to be in that setting wear a face covering, a face mask to limit the potential for droplets to be produced and spread. We also on our website have a specific document for high-rise shared apartment buildings, as well as information on driver training requirements. So if people do want more details, they can go to the alberta.ca/COVID website to look for specific detailed information on both of those settings.
All right, we've got time for 3 more. Operator, could you put through the next question, please?
Next is Bill Fortier with CTV News. Go ahead, Bill.
Yes. Hi, Dr. Hinshaw. Just wanted to know if you had any update on the outbreaks that were reported in some of the popular restaurants in sort of downtown area of Edmonton, Jasper Avenue. I believe there were 5 restaurants that had to shut down temporarily. Do you know if any of the new cases reported over the last 48 hours are linked to any of those, and if so, how many?
I will have to get back to you. I have the numbers, but unfortunately I don't have the numbers that we reported Tuesday. So there may be a small number. What I have here is 16 from Greta, 7 for Earl's Tin Palace, 11 for the Pint, and 10 for the Local. I should make a note also, which I neglected to say on Tuesday, that in some of those there's one individual who may be linked to multiple locations. So those particular numbers are all the people linked, but some of them are double counted because we have some people who were linked to multiple locations, if that makes sense. And we can get back to you about how many of those are new within the last 48 hours.
Operator, could you put through the next question, please?
Next is Jane Dirks with CTV National. Go ahead, Jane. Sorry, Janet.
Hi. Sorry, it's Janet. Dr. Hinshaw, thank you for taking my call. This is a question about the Verve condo building. You said there were 52 people who tested positive. How many among those, how many are active cases and how many are in hospital?
At the moment, there are 29 active cases of the 52. As of Tuesday, there was one in hospital, but I'm not sure if that individual is still in hospital, so we'll have to get back to you on that.
Operator, could you put through the final question, please?
Final question is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Good afternoon. Just going back to the NHL, under what circumstances would you pull the plug on a season that's underway or suspend it? And is that something that would be within your authority to do?
If there were any activity, whether it was NHL play or any activity that was causing significant extra risk to the public, if the guidelines that we have put out for various settings, so we again have the guidance document for professional sporting events that we've put forward to the NHL that has been accepted. We also have guidance for many other events, and so if, whether it's the NHL or any other event, were to forego those pieces of precautions that are laid out in the guidance, if again, whether it's the NHL or anyone else, were to say, we don't accept these anymore, we're not going to follow these, and there were to be transmission as a result, certainly if the guidance was not being followed, that would indicate a need to have further conversation, and if after that conversation there was still a lack of interest in following the guidance, then that would be the point, again, whether it's the NHL or anything else, that point at which more stringent sanctions would need to be put into place. Again, through any of the conversations that I've had to date, there's not been any indication that there's been concern with the requirements that we had put out with respect to protecting public health. But again, just like any other event, any other organizer, if guidance is not being followed, if it's being disregarded, and if the public's health is being put at risk, then we would follow the same steps that we would take with any other organizer in terms of that same kind of ladder of follow-up with conversations, education, and if needed, then measures to ensure that compliance was in place.
All right, thank you all for joining us. While Dr. Hinshaw will be away next week, we will continue to provide updates online every weekday.